my name is Ian. I'm a registered nurse at the Cambridge Cardiac Care Centre here, and I run the heart failure clinic. So we're going to be talking about congestive heart failure today. We're going to talk about congestive heart failure. Some of you may not have this diagnosis. However, some of you may have a diagnosis that could lead to it. So it is relevant to you whether or not you have congestive heart failure. So I'm just reading another notification. Okay, perfect. All right, let's get started. So what is heart failure? It's a state in which the heart is unable to pump enough blood to fulfill the body's needs. Simply put, either the ability to stretch or contract is impaired. There's often no cure. However, with medication and lifestyle changes, it can be managed. I'm unmuted here. Thanks, bud. It affects approximately more than 600,000 Canadians. It's one of the most common reasons for hospitalizations in North America. Are you at risk for heart failure, and how is this presentation relevant to you? So common risk factors for heart failure is if you've had a heart attack. If you've had a heart attack in the past, sometimes our patients that have had heart attacks maybe 10, 15, 20 years ago, sometimes they develop heart failure later in life. Also, if you have a history of high blood pressure that is very poorly controlled, it can lead to heart failure also. And also diabetes can be a risk factor for developing heart failure. Let's talk about what a normal heart is and what it looks like. In order to pump blood efficiently, the heart needs to be able to stretch, expand in size in order to hold as much blood as possible, and it also needs to be able to contract strong enough with enough force to push as much blood out as possible. It is a muscle. Your heart is a muscle, similar to other muscles in your body, and it acts as a pump. It's made up of 4 chambers. The left ventricle pumps blood to the body, and the right ventricle pumps blood to the lungs. So the right side of the heart gives blood to the lungs oxygenate the blood, and then it sends blood to the left side of the heart, and the left side of the heart sends it to the rest of the body. When you have heart failure, or when your heart is compromised, sometimes your lungs can feel the brunt or take the brunt of the damage. And what I mean by that is your heart and lungs, they work so closely with each other that if your heart is struggling, your lungs can be struggling too, and you can start having some shortness of breath. An abnormal heart. Let's take a look what an abnormal heart looks like. So in the center, we have a normal heart. On the right side, we have a diastolic heart. And on the left side, a systolic heart. So systolic heart failure is when the heart is ballooning out slightly, and diastolic heart failure is when we have a bit of some thickness in the bottom of the heart. The difference between these images are quite obvious. So when we have systolic heart failure, you have a ballooned out heart, okay? So when the heart is ballooned outwards, when it's contracting, the sides of the heart aren't getting as close to each other, and it's not able to pump out as much blood as it was before. With diastolic heart failure, this is the type of heart failure that people can develop when they have uncontrolled high blood pressure for a long period of time. I'll explain it like this. Let's say this is a normal heart contracting. So this is your normal heart, a normal heartbeat, but then you get diagnosed with high blood pressure. Then your heart starts doing this. So over time, your heart is contracting more forcefully, and over time it develops thickness in the bottom of the heart. And this can lead to diastolic heart failure. So what happens with this type of heart is it's contracting, but it has difficulty relaxing, okay? All right, so let's move on to the next slide. How does heart failure present? It usually presents with some shortness of breath. As I said, when your heart is compromised, your lungs can feel the brunt of it and can start having difficulty functioning properly and oxygenating the blood. Heart failure can also present with swelling in the feet, legs, and abdomen. Sometimes when you go to your family doctor, or if you've been to the emergency department, they'll often inspect your legs. Now, why would your heart be related to your legs? What's the connection there? We'll get more into that in a moment. Simply put, congestive heart failure, the term congestion, comes from your whole body being congested with fluids, including your legs. It can also represent as rapid weight gain, dry cough or wheezing, unusual fatigue or weakness, and also nausea or lack of appetite. Types of heart failure. Systolic heart failure. So the heart muscle has become weakened and cannot pump blood with enough force. This is the one that's ballooned outwards and it's pumping, but the sides of the heart aren't and getting as close as they were together, and they're not pumping out as much blood as they were before. As you note, just over here, it says low EF, less than 40%. Most of you that are patients at our clinic have probably had an echo. That's the ultrasound of the heart. What that is it looks at the structure of the heart. It looks at the thickness of the heart, it looks at the cavities, it looks at the valves. Now it measures the amount of blood that's pushed out with every pump. Every time your heart pumps, it pumps out a certain amount of blood. Normal is roughly 55 to 70%. This type of heart failure is when you have less than 40%. That's called systolic heart failure. So what is LVEF? That's what I just discussed actually. So left ventricular ejection fraction. So the left ventricle is what pushes the blood out to the rest of the body, and that's what we measure. So we have different grades of your LV. We have a normal, which is 55 to 70%. Grade 2, 41 to 54%. Grade 3, 30 to 40%. And grade 4 is less than 30%. The other type of heart failure, as we discussed before briefly, is diastolic heart failure. So most common cause of this is the thickening of the heart, and high blood pressure, uncontrolled high blood pressure can lead to this. So the heart muscle has become stiff and cannot fill with enough blood. So that's the one that I spoke with about how it has difficulty relaxing. So it's pumping, but it has difficulty relaxing and filling up again with blood. Another type of heart failure is valvular heart failure. You may have been told that after you had an echo, when we looked at the structure of your heart, that you might have a leaky valve. So valvular heart failure is when one or more of the valves is too narrow and blocks some of the forward blood. For example, aortic stenosis. It's also one or more of the valves is too leaky and some of the blood flows backwards instead of forwards, such as mitral regurgitation. There are a few different valves in your body. You might have been told you have a leaky valve, however, it might not be causing a problem for you. If you're told that you have a leaky valve and there's no planned intervention and it's not causing you any issues, great, it's okay, it's not a huge deal. However, if you ever start to have some maybe unexplained shortness of breath, it might be a cause might be a worsening valve, and you might want to talk to your doctor or your cardiologist about that. Diagnosis. How do we diagnose congestive heart failure? It's often initiated due to symptoms. So as we went over the symptoms before, some worsening shortness of breath, some swelling in the legs. If one of our patients developed this, or if you develop these types of symptoms, it could be congestive heart failure. And that's when testing is often initiated. It's also found incidentally sometimes with tests such as chest x-rays and CT scans, and also on echoes. That's the ultrasound again of your heart. And it can also be identified with some blood tests. Risk factors for heart failure. So as I said before, some of you may not have congestive heart failure. Great, that's awesome. However, you might have some other risk factors. You might have a history of coronary artery disease, that's plaque buildup in your artery. You may have had a prior heart attack, high blood pressure, heart muscle disease, valve abnormalities, congenital heart defects, diabetes, obesity, smoking, sleep apnea, lung disease, chemotherapy, family history, excessive alcohol consumption, and high cholesterol. So these are all risk factors that can lead to congestive heart failure. So if you have any of these risk factors, try to mitigate them if you can. So for example, if you are a smoker, try to reduce or quit smoking if you can. If you have a history of high blood pressure, try to control your blood pressure, take your medications, use other methods to help bring down your blood pressure. Prevention. How do we prevent congestive heart failure? Know the signs and symptoms of angina and heart attack. Seek medical attention early when needed. So when we talk about heart failure and heart attacks, they are different things. A heart attack is when you have lack of blood flow to the heart muscle for a certain amount of time, and it can cause sometimes irreversible damage to the heart muscle. So if someone has a heart attack, your actual pump is damaged, and that having a damaged pump can lead to congestive heart failure at the same time, or maybe later in life, maybe never. Also, moving on with prevention, controlling your blood pressure, targeting between 95/50 and 130/85. It can vary depending on what time of the day and what you're doing when you're taking your blood pressure. What we always suggest is to be sitting down for about 5 minutes at rest, not doing anything for 5 minutes, and then taking your blood pressure. Also, make sure we control your diabetes. Between 5 and 7 is ideal. And make sure you know what an HbA1c is. HbA1c is a blood test that we do that tells us what your blood sugar has been like for roughly the past 3 months. If you're a diabetic, make sure you know what your recent HbA1c is. Also, moving on, sleep apnea. If you have a history of sleep apnea, make sure you wear your CPAP. Why is a CPAP important, and why can sleep apnea cause heart failure? It's not something that would happen instantaneous. It would be something that could happen over a long period of time. If you don't know what sleep apnea is, essentially what it is when you're sleeping at night, you have less oxygen, or your airway actually clogs up for a little bit during sleeping, and it can lead to decreased oxygen at night. Now, why this is a problem is your heart will start working harder at nighttime when it should be resting. So when your heart should be relaxing at nighttime, it might be pumping like this. But when you're sleeping, you're not getting enough oxygen, your heart all of a sudden starts contracting more forcefully, just for the reason to get more oxygen to the rest of your body. So if you have a CPAP, make sure you do wear it, because it can lead to a thickening of the heart over a longer period of time. Also, avoid excess alcohol consumption, avoid illicit drug use, eat a heart-healthy diet, exercise, and quit smoking. Treatment. Okay, so we have congestive heart failure. What are we going to be doing now? Often with proper management, patients can achieve symptom control and avoid hospitalizations. Our site will help you manage medications, procedures, and also cardiac rehab. So we'll start with number 1, medications. It is important to take all your heart failure medications as prescribed. If you're experiencing side effects, report these to your doctor or the nurse or the CVTs, anyone at the clinic, and they will make sure that the right person knows. The thing is not everyone is exactly the same. We are all human, and we should usually respond similarly to most medications. However, some people have allergies, some people have intolerances, some people struggle with certain medications that everyone else is okay with. We don't want you to stop taking your medications without letting us know. If you do stop taking your medications, it could lead to very bad consequences. We have had some patients stop their medications and they end up in the emergency department pretty soon after because their body fills up with fluid and they can't breathe. So they need to be diuresed in the emergency department. So if you are having issues with your medications, let us know. There are usually alternatives. And often you will require multiple medications to treat heart failure. Some common medications. I think Michelle probably touched base on some of these medications during our pharmacy lecture. However, some of the most common ones are ARNIs, ACE inhibitors or ARBs, beta blockers, MRAs. I'm not going to get into the detail of these medications because they may not apply to you, but if you do have questions about some of those, let me know. The one I want to focus on though is diuretics. It's often known as the water pill. Simply put, with congestive heart failure, again, your body can become congested with fluid because your heart isn't working properly. If your heart becomes congested with fluids, what we want you to do is take a water pill to get rid of that extra fluid so you can breathe better and reduce the weight, the extra water weight that is in your body. So we talked about medications as an intervention. We also have procedures and surgical interventions. So your doctor may decide a procedure or surgical intervention may help improve your heart function or help with symptom control. These may include valve repair or replacement, CABG or PCI, revascularization, CRT or AICD, implantation. Those are actually devices that we implant in your chest in case you have congestive heart failure or if it's severe enough to warrant it. Not everyone gets it though. There is also advanced therapy, such as an LVAD, which is essentially a mechanical pump for your heart, and also heart transplant. But those two ones at the bottom there, for advanced therapy, we don't see those very often. Some of the more common ones are valve repair, CABG and PCI, and also CRT and AICD. So after medications and procedures and interventions, what else can we do? It's cardiac rehab. So our kinesiologist designs a safe and cardiovascular workout, keeping disease state and injuries in mind. It's structured and keeps you accountable, provides education to help you achieve your goals and stay safe, and provides access to health professionals for questions or concerns. The nurse who is initially involved with your consultation will usually be the main nurse to work with if you're having any issues. So when we talk about cardiac rehab, a lot of people see it as an exercise class. Increase your physical activity, lose weight, that sort of thing. It is, I want you to think of it as more of a lifestyle modification class. We do want to be restructuring some of your lifestyles in order to accommodate your new disease of heart failure or heart attack, diabetes, hypertension, whatever it is. But that's what we want you to look at it as. Historically, we used to bring all of our patients into the clinic here to exercise on the treadmill in our gymnasium. Now, however, during a pandemic, we're trying to do things at home, which has been actually working out very well. Now, we are going to be touching base with you once or twice a week, depending on what's going on with you and how stable you are. And they're going to be going over different types of exercises that you can do, going over your diet, going over your vitals, and notifying nurse or Dr. Pandy if there's any issues. So what can you do to help your heart failure? Know the signs and symptoms of fluid retention. So fluid retention, again, I'm going to say this because I love saying it. Congestive heart failure is your body being too congested with fluids, and you can lead to worsening shortness of breath and also swelling in the legs. So the signs and symptoms of fluid retention is swelling in your legs, worsening shortness of breath. If you're waking up in the middle of the night suddenly short of breath, that's a big indication you might have congestive heart failure. Let your doctor or nurse know when you're experiencing these sort of symptoms. Make sure you track your weight. I always tell my congestive heart failure patients, weigh yourself daily after urinating and before breakfast on the same scale, and wear the same sort of clothes when you're doing it. If you wake up and you're just wearing underwear, consistently weigh yourself every day in just underwear. A weight gain of over 4 pounds in 2 days or 5 pounds in 1 week would be considered significant. Also, what you can do to help your heart failure, manage your other health issues, and also take steps to prevent other illness. Treatment, your role. So as we spoke about this before, the handful of risk factors that are out there that can contribute to worsening heart failure or cause heart failure, some of them can be mitigated because some of them can be controlled through lifestyle changes. We want you to be quitting smoking, limit alcohol intake, manage your stress, maintain a healthy weight, get enough rest, exercise, monitor fluid intake. You may need to restrict fluids if drinking in excess of 2 liters and retaining fluid. It's important not to over-restrict. It can lead to dehydration, and also eat a heart-healthy diet. I want to touch base on monitor fluid intake. So I get so many times family, loved ones of their parents, or just any people in general, they always think that drinking as much water as you can is good for you. Always pushing fluids, drink 4 or 5 glasses of water a day. We've always been told this. However, things do change a little bit with our congestive heart failure patients. So our patients, they are very prone to retaining fluid in their body, so we don't want them to be drinking too much fluid. We do usually start with telling our patients to drink roughly 1.5 to 2 liters a day to give us a bit of a range. However, it can vary person to person. I have some patients that are maybe 120 pounds, and if they drink 2 liters of fluid, they're going to be fluid overloaded very quickly and become congested and have worsening shortness of breath very quickly. Meanwhile, I also have some people that are maybe 300, 350 pounds. If they have 2 liters of fluid, they're feeling okay. So it does depend on person to person and the situation we have at hand. Usually it does take a little bit of time to determine what is the right amount of fluid you should be taking in during a day. Now we can also run into other issues if you have a history of kidney disease. So if you have kidney failure, our nephrologists, who are the kidney doctors, they usually want those patients to be pushing fluids. They want to have enough fluid to be perfusing their kidneys to make sure the kidney function goes up. But if you have heart failure, we want to cut back. So we run into this bit of a dilemma where we want too much and too little. If you're running into that sort of situation, let us know. We can help walk you through it. I got a little sidetracked there, but let's keep track with your role. So track your weight. Oh, we already spoke about that actually. Oh, I think we did that slide actually. My apologies. Okay, treatment, your role. We also want you to be reducing your salt. So in addition to cutting back on the water, what is probably more important or just as important, we want to be reducing your salt intake. We usually suggest between 1,500 to 2,000 milligrams per day. However, a lot of you have probably heard 2,300 milligrams per day. So that's 2.3 grams. I don't want to get too caught up in the numbers, but let's just call it 2,000 milligrams per day. So as a general rule of thumb, no added salt. So no more adding salt onto the food that you're eating. We want to be limiting sodium containing condiments to 1 teaspoon. So if you have some hot sauce, or if you have some soy sauce, limit it to 1 teaspoon. Also, we need you to be really conscious of food labels. So if you look at the right here, we have a nutrition label. They're on the back of every single product that you can get at the grocery store. If you look at this area highlighted in red, that is sodium. As you can see, it says 520 milligrams. Okay, so serving size, you also have to look at the serving size, which is 1 can. So if you have 1 can of, let's call this chicken noodle soup, you'll get 520 milligrams sodium. Now let's say the serving size said half a can, but it still says 520 milligrams on the sodium. So if you eat a whole can of this chicken noodle soup, you'll be getting double the amount of sodium that it says on the label. So it's very important to be able to know how much sodium is in the product you're eating and what the serving size is relating to that sodium content. Also, as a general rule of thumb, watch out for high salt meats, lunch meat, jerky, sausage, bacon, ham. All those are very processed and there is a lot of sodium in there to preserve them. There is a lot of sodium in there. Also making sure to avoid canned or boxed foods. As again, general rule of thumb, things that are preserved or made to be kept for a long period of time will have a lot of sodium in them. What has sodium in it? I'll give you a moment to take a look at this. So in general, people usually take roughly 3,400 milligrams of sodium per day. That is quite a bit, and with our congestive heart failure patients, we do suggest quite a bit less. You will receive the amount of sodium in your body. Sorry, let me rephrase that. You will receive the appropriate amount of sodium that your body needs to function on a daily basis through foods that you just eat regularly. It's very rarely that you will be low sodium. If you're in the emergency department or if you're ever told that you have low sodium, listen to what the healthcare professional says, but go to the emergency department if it is very low, but it is very, very rare that that ever happens. So finally, to help manage your congestive heart failure, this is a time where a lot of us are alone. We are alone at home, and we need to be taking care of our mental health. Heart failure can lead to an abnormal lifestyle that people are used to. People aren't able to do the things that they want to do. A lot of people that have heart failure have struggled with basic activities that they used to do that they can't do anymore. I had this one gentleman that he became so short of breath, he wasn't able to play with his grandchildren anymore. I had other patients that used to bike every day. However, they developed heart failure and they were unable to ride their bike to work anymore. So there are some aspects of your life that might have to be adjusted, or you can work towards them. Now, the thing about congestive heart failure, we said that there is really no cure. However, it can be managed. And when you have a weak heart, we want to strengthen it. And you can strengthen it through the medications, the lifestyle, and cardiac rehab. So thank you for attending the congestive heart failure lecture for Cambridge Cardiac Care. If you have any questions, my name is Ian. I'm one of the registered nurses at the facility here. So if you want to talk about heart failure, if you want to talk about your maybe a heart attack, if you want to talk about the medications that you're on, you can let me know. I will get back to you.